Namaskar, I'm Ashok Vyas, and today is an important day as we are going to be talking about your health, and your health in a way where you are not limited to the present tense alone. Your health in a composite way, and that's what one would refer to as Vedanta way, where they take into account your timeless essence, what these terms are, and how Vedanta and health became an important subject at Parliament of World Religion. I have the pleasure of someone who is going to be serving World Parliament of World Religion as Vice Chair, and I congratulate as well as welcome Dr. Bhadra Shah to our studio. First, Namaste Bhadra ji.
Namaste ji.
And then someone who has prepared on this theme and shared with world at large at this important esteemed parliament. He has been helping community in learning more about Dharma from various aspects, various nuances of what are the spiritual significance of various festivals. Dr. Nbarendra Bhalodkar ji is with me. Namaste.
Namaskar. Namaskar.
So both of them are physicians, they are doctors, gynecologists and cardiologists. So, Bhadraji, I want to begin with you. As a child, when we heard the word health and in Hindi or Sanskrit, swastha, so अपने आप में स्थित होना स्वस्थ ऐसा माना जाता है. But the kind of medical science which we have, do you see that meaning continues to exist in our medical science?
I think so, because in medical science also, sickness is what? Aswastha. You are not swastha, that is aswastha, and that is the reason why you see the doctor to make you better or swastha again. So I think that is what we try to do, and all different sciences, including allopathy, wants to do it, but there are times which is not, it's not possible, and also the other factors comes in, and we are all human beings, so sometimes trying to make you swastha, we may make you more aswastha. It can happen, but there are some advantages of each pathi, Ayurveda or allopathy, homeopathy, all different kinds of sciences which tries to make you swastha. When you are aswastha, we have to find which one is better, in which circumstances, then you are ahead of the game.
Wonderful. So let's be ahead of the game and learn from the expert. Yes. Dr. Nbarendra ji, your take or your definition of swastha, and if you look around maybe in some actors or some sportsmen, anybody who you feel appears to be swastha or ideal swastha in your perception?
I think the ideal swasthya, let's just go to first WHO, how WHO defines health, which is internationally known. It is not merely the absence of disease. So absence of disease is not swasthya, but it is the health, total health, global health of body, physical body, mind and intellect or man. So that is what WHO defines. We in Ayurveda and in Vedanta go one step beyond, and we say it is not only mind and physical body, we also go soul. So we have three kinds of bodies, as you know, which is called gross body or sthula sharir, then causal body, and then sukshma sharir. So these are all three different kinds of sharir, and we should be swasthya in all three. So Vedanta goes one step above and beyond WHO. So if I have to say who is the ideal person suited that I think are the best healthy people, I would say most of them are swamis, because they really have physical health, they have mental and emotional health, and the spiritual health also. So I think any of the swamis that are really achieved their goals are the most people who I see are the total swasthya.
So total swasthya and Swami, when you hear and you see the picture of Swami Vivekananda, and most of us are aware that the way he left his physical frame was because physically he was not swastha. So anyway, I'm not questioning what you said. I get to the spirit of where you are coming from. But going by the spirit of understanding, Dr. Bhadraji, the medical science as we have, does it recognize soul in any way? Because when you are talking to any medical student, and the typical definition of science which we gather, if you cannot measure it, it doesn't exist.
That's
So you cannot measure soul. So from scientific point of view, what is the situation there?
Yes, I would say so far in medical science, in allopathy, it was not existent. But I think when Swami Vivekananda came and he introduced Vedanta, and then yoga and Ayurveda and everything is becoming part of medical science. So gradually it is improving, and including now university, major universities also, there are courses for meditation and yoga, and there are places where even Ayurveda is included. So I think eventually all different pathis will be integrated, and that's what we call integrated medicine, because allopathy is great in emergency. I think, say if you have appendicitis, Ayurveda or homeopathy or yoga, nothing will help you. It is the science of allopathy, surgery will help you, and you will be great next day. But in chronic problems, other pathis will be, Ayurveda will be great in chronic problems. And in overall, I think this day and age, young people have so much stress. I think with all advances in science, I'm seeing a lot more distress and stress. And young people, so many of them are on 2-3 medicines to calm them down, while our yoga and meditation and alternative and integrated medications, therapies will be a lot more useful in these situations.
So now, very interesting, because Dr. Nbarendra is a cardiologist also, and in your presentation about Vedanta and health, you also talked about the role of mind or mana. So as a cardiologist, what would you say, or thought pattern, how it affects our heart?
Well, what happens is when your mind is agitated, it creates some fundamental physiological changes in the blood and the whole system, including nervous system and autonomic nervous system. And it increases what we call sympathetic tone, which increases heart rate, blood pressure. It agitates small, tiny cells called platelet cells, which are important on causing heart attacks and creating chest pains. And then there are lot of other medical chemical substances like serotonin, etc., which I don't think is a platform for here. So if we want to see that doing meditation or calming your body through yoga is helpful or not, so then I will refer you to medical literature. There is a doctor called Dr. Dean Ornish. Dean Ornish was highly influenced and highly impressed by his guru from India called Swami Satchidanand. And he kept talking to Dr. Dean Ornish about yoga, meditation, plant-based diet, and its effect on health, total body health, including physical health. So what he did is he followed his guru's advice, and he did a randomized trials. Randomized means you really randomize patients. Half of the patients will get a conventional treatment that medical treatments people are giving, and another half were given conventional treatment, on top of it dietary, meditation, yoga, and exercise. And these patients all had angiographically proven coronary artery disease. That means they had blockages. So this program went on for significant amount of time, and at the end of the trial, when they did a repeat angiogram, the blockages in the group which was followed by plant vegetarian diet, yoga and meditation, the blockages were reversed, as opposed to other group, which was a conventional allopathic treatment, the blockages increased. So you could say, well, what is the difference? I don't see the blockages myself. But it also transcribed into visits to emergency room, how many times patients got chest pain, and how many patients had heart attacks. So this therapy that we're talking about meditation, yoga, and plant-based diet, does have a role over and above the conventional medical therapy that we offer.
So there is a role on how you think, what you think. What you think about yourself makes a lot of difference in terms of what you can achieve. We hear that frequently, and in the presentation on Vedanta and health at this important forum of World Parliament, Dr. Narendra also referred to a Swamiji and said that physical body is a wish fulfilling jewel. Chintamani.
Chintamani. And so what is Chintamani? Chintamani is something, it is like alchemy in the health, in the life. So what is the purpose of human life is to achieve the goal of God, reaching God, and serving the other humanity and humankind, or all the living beings. To do that, you have to be healthy. Unless I am healthy, I can't pursue these two goals, because in a healthy body is what will need it. If I want to do some charity work, or if I want to do some kind of a camp or study Vedanta.
Talking about the direct way of finding the balance within which would open the door of bliss. What is the meaning of bliss? I don't know, and I'm not asking Dr. Narendra ji also. But right now, what I want you to share with us is you talked about balance in doshas, in Agni, balance in dhatus, proper elimination of waste, etc. So elaborate a little bit on this from the key point of balance and why balance is so important.
Well, I think that's a quote from Ayurveda, which is one of the Ayu means life and Veda means knowledge, and Ayu means long life and healthy life. So this is a Veda about how to live long and healthy and happy. Without going into much in details of three doshas and sapta dhatus and Agni, but I think the take-home message is there is a balance and a moderation. This is the two key element in Ayurveda, that everything should be in balance and in key and in moderation. And that should be the goal of whatever we are, whether we are having activities, whether we are talking about sleep, whether we are talking about food, whether we are talking about any other activities. It has to be in balance and moderation. And one ought to keep, and in the second half of the same slok that we have in Ayurveda, it should be prasanna atma, prasanna man, and prasanna indriya, and then a blissful soul, and that is the health. So that is what we need to do in terms of doing this. Now, how do you balance it? Just to give you an example on diet. In Ayurveda, the diet has been divided into three groups. One is called sattvic diet, another one is called rajasic diet, and third one is called tamasic diet. The sattvic diet is basically wholesome, freshly prepared, not overcooked, and not overprocessed. So what are those things? Fresh vegetables, fresh nuts, seeds, fruits, legumes, etc., and less processed food. And I am a vegetarian, but what we are doing is we're overcooking the food. We so much fry them, we overcook them, so we are losing the important nutrients in this sattvic food. So one ought to have majority of the diet in sattvic food. Let's go to tamasic food, which is very easy to understand, and then in between is the rajasic food. So tamasic food is basically meat, meat products, stored food, stale food, and smoking, alcohol, opioids. These are all tamasic food. So one ought to move away from tamasic food. Right now in United States, we are seeing opioid crisis. We are seeing so many deaths related to opioid. Now that's a tamasic food. And alcohol. We see so many deaths related to alcoholism. So this is tamasic food. What is rajasic food? Rajasic food are spicy, tasty, cooked food, coffee, tea. So rajasic food, I would say, is anything that you like to eat which is tempting. And we are always tempted to so many different foods because we go to buffet dinners, we go to parties. So those are all called rajasic food.
Right. Allow me to interrupt you, because what you are saying will not be a good thing for someone who is looking at economic growth, because all these things are market oriented. The fuel for economy to grow is the way we have structured our society, our system now. And I'll come back to you, but there was another reference which Dr. Nandar brought out in his presentation, quoting Saint poet Bhartrihari, which is Bhoge Roga Bhayam. So in enjoyment lies the fear of disease. Now, when you eat one rasgulla, you want to eat another one, and that's what is called as vasana. How to do away with vasana and how to stop the idea of seeking pleasures is very, very difficult. First of all, very few people would buy this when they really need to buy it. They'll buy it later on when the physicians are telling them, but when it is made clear upfront, then it becomes difficult. So, Dr. Bhadra, what has been your experience? You have met so many people. Do people subscribe to these ideas when they are healthy?
It is difficult, but when they see, when they try to subscribe to that idea, like children, they want to eat 10 rasgulla because they can digest it at that time. But when they see what happened to the mom and dad, okay, mom is very sick with her blood pressure and father is sick with her diabetes, then I have seen many young people who will tell parents, mommy, one is enough, don't take the second one. So I think those people who keep the eyes open, when they see the problem around, then yes, then they will put it into practice earlier. But those who have not seen, also those who have some ambition of doing something good and feel good, and they know that until I feel good, I won't be able to do what suppose if I want to be a doctor, but if my health is not good, then I won't be able to do. And that's those who are motivated to do something, they will be able to listen to this before, much earlier than waiting till the doctor says. I have seen many young people who are doing this, and it is just the control on your mind. Nobody will say that you don't have to do anything. A glass of wine also will help you, but if you keep going, as you just said, it's vasana or ichcha. Some of the ichchas are like that more you satisfy, worse it gets. 1 and 2 and 3 and 4, it goes worse and worse, and then it is very hard. Once you have 4 drinks, you wouldn't know what is happening. But if you have 1 drink, that will help your heart. So I think teaching of Vedanta and good habits in the school and at home, and children see what the parents are doing. If parents are doing prayer in the morning every day and they just eat in praman sir, in proper amount, it's not necessary to stop eating everything other than what he said, just salad. They say grass eaters, if you just eat salad and fruits. No, you can eat everything, but just in a praman, just moderation. Then it will help you. But other than that, and it is, you have to control yourself. I think all of us have a potential power. We have to take it out. I can't do it. No, keep saying, one Swamiji used to say that in Switzerland, at some places the train goes steep up like this, and there is noise that, yes, I think I can, I think I can. So if you remember that train, and suppose when you are attracted by a second rasgulla, I think I can stop.
I also say, I mean, many people say, I think I can, but they say, yes, I can eat one more. So I can is being applied in a different direction.
Right.
But what I would also like us to understand is sometimes people think that, oh, he eats everything and yet he's fine, and the other one was observing so much restraint in his food habits, yet he got to undergo bypass surgery. So DNA, some people say that if your DNA is fine, you're born to be healthy, then you are healthy, and whatever you do, it doesn't affect. So talk to me a little bit about Dr. Narendraji from the point of view of arteries, blockage. As a cardiologist, what would you say is the percentage, the way you are born and your food habits and other habits?
So I think coming back to heart condition or coronary artery disease, one ought to inspect what are the risk factors, and then we can divide those risk factors into modifiable and non-modifiable. One I can't modify is a gene. I cannot change my hereditary. Of course, gender. Males are more likely to get coronary artery disease than female. Female are protected as long as they have their menstrual periods going on and they are not postmenopausal. So I cannot change my gender, I cannot change my genes. But what I can change is take good care of the other risk factors. And what are the other risk factors? Of course, diet, which we talked about in a little earlier. Exercise, physical exercise, cardiac exercise, I can do or I cannot do. If I can do, I should do, and that will prevent me from getting into heart condition. High blood pressure, diabetes, eating in moderation, and start all these practices not at the age of 60. We want to start this at the youngest age, possibly in the school. The reason being, we have three kinds of prevention in medical science. One is called secondary prevention. Second is called primary prevention. And third one is called primordial prevention. The best kind of prevention is the primordial prevention. Before even the risk factors for those things develop in your life. So the risk factors for hypertension, diabetes, obesity, metabolic syndrome, before they even develop, we should start working at it. And that's called primordial, and that starts at the beginning of the childhood. Secondary means I already have a heart attack and now I want to prevent the secondary heart attack. That is called secondary. And the primary prevention is, say at the age of 30, 40, somebody realizes I want to change my life. He does not have a manifestations of coronary artery disease, but he is changing his life. Not that he doesn't have an occult coronary artery disease. He already has. Medical science has shown that the blockages of the coronary artery starts at as early as the age of 15 to 20. So a 40-year young gentleman who wants to prevent heart attack, he already is on the road to have a heart attack, but it has not clinically manifested. So that's the primary prevention. So these are the three kinds of prevention.
So there are many kinds of preventions, and when you look at yourself from Vedantic point of view, as we heard from Dr. Bhadra and Dr. Narendra, everything boils down to what you aspire from yourself. What is the motive with which you are accepting this physical gift which is given to you by nature, or you have it with you, and how to keep it fit. There are various ways that includes paying attention to what you eat, not just what you eat, but also what you think. This subject indeed demands a lot of attention, but that we probably should be paying on individual basis. And what we gathered from Dr. Bhadraji and Dr. Narendra Bhalodkar today is indeed a source of inspiration and seed of inspiration to think more and apply in our life to stay healthy and realize optimum level of happiness. Once again, thanking both of you and thanking all of you for being with us. This is Ashok Vyas.